This is Lola.
And how old is Lola
She's
now?
6 months old now. She's our miracle baby. So I found the lump myself. When I switched doctors, we decided to do an ultrasound and then a biopsy, and then I was diagnosed. I actually kind of sought out Dr. Terstriep just because we knew we wanted to have kids, and so trying to preserve fertility, we wanted to find a doctor who would support us with that, and Dr. Terstriep was amazing with all of that. So we came here and kind of started working, kind of collaborating with her and reproductive medicine to get the ball rolling before I even started treatment. I had the egg retrieval, my port put in the next day, and started chemo the very next day after that. So it all was just like one after another.
Tiffany came to me when she was just a newlywed. She was diagnosed with breast cancer very shortly after she was married. So very young, lots of dreams and hopes ahead of her. We really need to think about fertility planning and preservation if we're going to start chemotherapy. So that is an immediate discussion that I had with her. And so she was able to, we were able to freeze eggs ahead of time before giving treatment. And that is, in case that the ovaries don't work after chemotherapy. And that can be it's not an infrequent complication of cancer treatment. And so she really accessed the use of acupuncture and psychology, and as well as the technical aspects of the reproductive endocrinology team to then deliver a beautiful baby girl.
We used to think of breast cancer as like 40 and over, and it's really not. There's so many young women being diagnosed, and with our case that there are options before starting treatment to try and have a family after treatment. Like, it doesn't have to be the end of those dreams for you. Seek out what your options are before starting treatment. So often we don't want to accept help, and you can't fight this battle by yourself. You have to have people support you.
We've gotten so much better about caring for the whole person, and how do you move forward after this diagnosis. You have a huge support network for patients, from psychology to social work to financial counselors to integrative educators to survivorship programming to nursing, and so many people that are there to help support people as they go through this journey. It's everything the reasons why I do this is to try to get people to fulfill their dreams after cancer. Seeing that little baby is just like a perfect example of everything we work towards, and seeing her happy is a beautiful thing.